Do you know one of the scariest things that happened to me as a child? My siblings and I attended a primary school distant from home. So we usually joined the school bus to school. On this fateful day, on a very hot afternoon, we were on our way back from school. I sat on a separate seat. Ujunwa, my little sister, sat very close to my brother on another seat on the opposite aisle of the bus. All of a sudden, I heard someone shouting, Ujunwa, 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 Ginnemegi. It was my brother's voice, and the Ujunwa was my own Uju. So I sprang up, ran towards them, and lo and behold, my baby sister Ujunwa was jerking vigorously. I was confused and helpless. I noticed the colored part of her eyes had disappeared. I could only see the white parts. My heart sank. I thought she had died. Then she dropped from her seat to the floor of the bus, and in that chaos, the driver noticed what was happening and immediately cleared off the road and asked one question. Did she wee on herself? I said yes. He said, that's fine, let's take her home. It didn't make sense to me. Why will you take her home? She's going to die before we get to the house. But the driver moved on. So I carried my baby sister on my little arms, and she was staring calmly as if nothing had happened. Juliana Ome is the name. Convulsion in children is the topic. Convulsion is a medical condition where the muscles of the body jerk without control. There are different types of convulsion, but in this health talk, which I'm dealing with the convulsion that happens in a child when the child has high fever. This type of convulsion is called febrile convulsion or febrile seizure. Febrile convulsions happen between the ages of 6 months and 5 years. Now, this is what happens. The brain is what helps us coordinate movements in the body. And this thing happens like electric signal sent from the brain to the body. Anything that causes this electric signal to be too much will make the body to move vigorously. It will be like a spark, and the body will convulse. And in young children, high body temperature can cause the spark in the brain, and they will convulse. So anything that causes the body temperature of a child to increase, to go up, can make that child to convulse. Things like infection, which can be caused by different germs like viruses, bacteria, and so on. And also, convulsion is likely to happen in children whose parents or family members had convulsion as children. Please, when a child is convulsing, the most important thing to do is to place that child on the left side, on the child's left side, and remove every object that can harm the child. Clear the space so that the child will not hit anything in the process of convulsing. When you place the child on that left side, the tongue will not fall back, so the child can breathe even while convulsing. And again, remove any tight clothes on the child's body and wait for that child to stop jerking. Now, observe the child to know how long the convulsion lasted and check if the child peed or pulled on the body. Now, if you ever see a child convulsing, even as an adult, you'll be afraid. But be calm, because it's like an electrical spark from the brain, and it will wane off by itself. It will stop by itself. Once the brain makes the body to move vigorously, nothing will stop it until the brain stops itself. But out of fear that the child may die, parents do a lot of harmful things to the child. Please be calm. The target should be to help the child's temperature to reduce so that the child will not convulse again. Now, don't do any of the following. Don't rub palm kernel oil over the baby's body. Don't apply engine oil on the body. Don't apply crude oil on the body. Don't apply shea butter cream on the body. Don't apply anything oil. Avoid them, because oil will block the openings on the skin where heat is supposed to escape from, and that will even make the baby's body to heat up the more. And this is exactly what we're trying to avoid. Don't force spoon into the mouth. Error. In the process of forcing spoon into the mouth of a convulsing child, you can remove a tooth which may fall back and block the airway where air will pass from, a child will choke to death. Don't heat up the baby over an open fire or burn the feet of the baby. This will only make things worse by increasing the baby's temperature and even cause burns for the child. And this is all another problem altogether. Don't rub cow's dung or cow's shit on baby's body. Don't give the baby urine to drink. Don't give baby any concussion. In fact, the child should not be given anything to drink. Just leave the child for some minutes. The convulsion will stop, and you take the child to the nearest hospital. Remember my experience with my little sister when we were kids. You don't need to do anything. The convulsion will stop. It can even cause more harm to the child when you panic and do the wrong things. And now the child will end up with more serious problems. People think it is what they did that made the convulsion to stop. No, it is not. The convulsion stopped on its own. Prevention is key. If your child has ever convulsed before, that child may have another episode. And the best thing to do as a parent or caregiver is to recognize the danger sign and take care of it. And this danger sign is fever. Once the baby's temperature starts rising, cool it immediately by doing the following. Remove the child's clothes, soak a towel inside the normal water, tepid water, and clean the baby's body with it. This is called tepid sponging. Check the baby's temperature with a thermometer. If it's up to 7.5 degrees centigrade and above, give that child paracetamol and take that child to the hospital. Please don't sit at home, especially if that child has ever convulsed before. Convulsion in a child is a very scary sight. But convulsion has its own time and it will stop on its own. Whether you put spoon in baby's mouth or not, or pour engine oil or not, that jerking will stop. Please, convulsion in a child is not a spiritual problem. It is a medical problem that needs urgent medical attention. When next you notice a child convulse, don't be afraid. Just try hard to be still, to be calm. Once the episode is over, take the child to the hospital. Children who have convulsion have suffered more harm due to the wrong things their parents did out of ignorance. And some of them have even died from the careless treatments they received from their parents. And I don't want this to happen to anyone. So I put this health talk together and I hope you found it helpful. I love you all and I remain your favorite health talk personnel on YouTube. Please do well to use the comment section for your questions and your comments. And click on the like button if you learned something from this health talk. And of course, subscribe if you're yet to. Thank you very much and see you again.